wait another minute or maybe less than a minute to give other people the opportunity to log on. Okay, folks, I think we're going to get started. Welcome again, and thank you for joining us today. We're really excited to discuss the use of non-competes in the healthcare industry with you and answer whatever questions you might have. This year has seen a lot of developments in this area, including as recently as last week. My name is Sal Gangemi. I'm a partner in the Labor and Employment Group at Murtha Cullina. I've actually worked with some of you who've registered for this webinar, and I look forward to continue working with you. As we get started, I just want to take a few before I pass the mic over to Steph. I'm going to just cover a couple of housekeeping items. Just so you're aware, all attendees are in listen-only mode. We cannot see or hear you. That said, we do encourage interaction during today's webinar. You can write comments in the chat box on the right-hand side or wherever it is on your screen, and we will do our best to answer your questions at the end of the webinar. Okay, so I'm just going to pass over to Steph, allow her to introduce herself, and then we get started.
Thanks, Sal. Good afternoon, everyone. My name is Stephanie Sobkowiak. I'm the chair of our healthcare group here at Murtha Cullina. As Sal mentioned, also I've worked with many of you on a wide variety of things. I work primarily with hospitals and physician groups on all sorts of needs, whether it be corporate, regulatory, compliance, HIPAA related, really the full gamut of business needs that healthcare providers have. But today we're going to be focusing on really non-competes in the healthcare space. As Sal and I were talking about what we might do that's timely, we were sharing honestly a few chuckles over some of the bizarre non-compete questions that we've seen over the last few months. And he and I spend a lot of time working with clients on that topic. We had no idea a month ago when we were talking about this that the topic was going to be quite as timely as it was, and that we were going to have developments, particularly on the Connecticut front, just a few days before we were giving this talk. So that worked out. I am going to start by talking about the current law in Connecticut in the healthcare non-compete space. As many of you know, the current law, we've called it the new law for quite some time, but the current law has been in place since 2016. What types of relationships does that Connecticut law apply to? It applies to employment and other contracts that create or establish a professional relationship with a physician. And the physician piece is key because up until now, which we'll get to in a few minutes, the state law has really been focused on just physicians, not any other types of clinicians. And it applies only in the context of a professional relationship. So Sal and I often get questions about, we get it. We get that this law applies to non-competes in the context of employment or in the context of professional services agreements. But what if I'm buying a practice? I'm spending a ton of money, regardless of the form of the practice. I'm paying the seller a fortune. I want to be able to impose a non-compete, and I want that non-compete maybe to be broader than or different from what the state otherwise allows. And while we don't have any great cases in Connecticut, Sal and I both think that in the context of a sale is different than the creation or establishment of a professional relationship. And so keep in the back of your mind that you may be able to, if it's otherwise justifiable, impose something broader or longer in the context of a sale of a practice that might be different in the creation of a professional relationship, which is really what the state law applies to. So what are the restrictions? If you've got a professional relationship between an employer and a physician, what does the current law say you can, or just as importantly, cannot do? So if you've got a covenant not to compete that was entered into, extended, or renewed on or after July 1, 2016, when the current law became effective, you can't restrict the physician's activities for more than a year after the relationship ends, and you can't restrict the physician in a geographic area of more than 15 miles from what was the physician's primary site. And interestingly, in the current law, primary site can be one of two things. It can be a site or a location that the physician and the employer agree on and prudently write into the agreement at the outset, or the statute contains a default. If the primary site isn't clear in the agreement, the current statutory default is the location at which the physician earned most of their revenue. So in other words, if the physician works in one office 3 days a week, another office 1 day, it's that 3-day-a-week location that's likely to control for the what will be the center of the radius. Secondly, under the current law, an employer is not able to enforce a non-compete on a physician employee if the employer terminates the relationship, unless the employer terminates the relationship for cause. So if the physician employee has done something egregious, the employer is invoking the for-cause termination, the employer can seek to enforce the non-compete. But if the employer merely decides we're going to go in a different direction with our specialties, or the relationship has deteriorated and doesn't want to continue, but not to the point of for cause, the employer would not be able to enforce the non-compete. Under the current law, the employer also can't enforce a non-compete against a physician if the agreement simply expires, assuming the agreement wasn't entered in contemplation of ownership or partnership. But if you have a typical employment agreement and it says that there's a 2-year term, and it doesn't say anything about any renewal or extension possibilities, and the employer and the employee just let the agreement die, the employer is not able to impose a non-compete on a physician in that context. And last, and perhaps most importantly, under the current law, a non-compete against a physician is only enforceable if it's separately and individually signed. And so I see a few different things. A few different things have crossed my desk. I myself have done it a few different ways. Sometimes a non-compete or non-compete terms are embedded right in the employment agreement. You know, there they are in section 4 on page 5, and we'll put a separate signature line right there in the middle of the agreement relating to the non-compete terms. Sometimes clients say that just looks weird. They don't like it, or they're afraid it's going to get missed in the signing process. So sometimes we'll add a separate signature line at the end of the contract, but making it very, very clear that that second signature relates back to the non-compete. And then, of course, the gold standard would be to have a separate non-competition agreement that might be an exhibit or an attachment to the main employment agreement, but a separate document that the parties would sign. As I've said a few times, this law has been in effect since July 1 of 2016. And so in theory, agreements that were entered before July 1, 2016 are grandfathered, if you will. The tricky part, and by grandfathered, I mean, you could potentially have a longer or broader non-compete that was in a physician employment agreement entered before July 1, 2016. The tricky thing is that this current law applies to any non-competes that were amended, extended, or renewed after July 1, 2016. And we've got one Connecticut Superior Court case where the court says, let's be serious, an automatic renewal is a renewal. A renewal is a renewal. And so in that instance, there was a 2-year initial term in the agreement, and it had standard language, which many agreements have, that said at the end of the initial term, this agreement shall renew automatically in successive 1-year increments until one of the parties terminates it in accordance with XYZ. And that non-compete became enforceable when July 1, 2016 passed, the agreement automatically renewed and nobody did anything. And lo and behold, of course, the non-compete wasn't separately signed because no one was thinking about that back in 2012 or whenever the agreement was entered. And so I think the big lesson from that court case was automatic renewal is the same as a renewal, which triggers these restrictions.
Drum roll.
All right, so what's changed? For many years, I'm sure many of you have had your eye on, is Connecticut going to restrict a physician employer's ability to impose non-competes even further than it has? Is it going to prohibit them outright? I think every legislative session for the last 7 years has had at least some preliminary bill further restricting employers' ability to impose non-competes on physicians. And lo and behold, of course, we'd have a new public act 5 days before this. So it's sort of a very more timely even than we anticipated. So as of last week, we've got a new public act. For those of you who are real geeks and want to read it yourself, it's 23-97. We have a new public act in the state that goes into effect July 1, but really doesn't become effective until October 1. Those are the sort of trigger dates for our, for our purposes in terms of dates of agreements. So under this new public act, a covenant not to compete that's entered into, amended, extended, or renewed on or after October 1 shall not be enforceable if the physician does not agree to a proposed material change to the compensation terms of the contract prior to or at the time of the extension or renewal. We'll come back to that in a second. And the second thing the new public act does is it removes the caveats on expiration relating to contracts that might have been entered in anticipation of partnership or ownership agreements. It just makes it easier, for better or worse. And it says, if the contract expires and the employer doesn't renew it, the employer is not going to be able to enforce the non-compete on the physician employee. And it also, again, makes it clear that the only context in which the employer terminates the physician's agreement and is going to be able to enforce it is if it terminates the physician for cause. Now, going back to that first point, Sal and I have spent a little time just chatting in the last day or two. What in the world does that mean? You can't enforce it unless the physician agrees to a proposed material change to the comp terms. There isn't a ton of guidance, as you could imagine, yet in the last 4 or 5 days. Certainly it means that the legislature doesn't intend that employers get the benefit of a non-compete for free, right? And Sal, chime in, with any other thoughts, but there's often in the forget about healthcare, in the general business world, this context of sort of paying separately or paying more for a non-compete. And that's what the legislature, I think, is very much getting at here. Interestingly, those 2 additional rules or 2 additional restrictions don't apply to physician groups of 35 or fewer, so long as they're majority physician owned. And so the legislature seems to have intended to carve out small physician groups from those additional obligations, and query whether 35 is small or not, but that's the number we've got. And then the other change that the Public Act makes with regard to physician non-competes is that I had mentioned a few minutes ago that under the current law, if the agreement doesn't prescribe what I'll call the center of the radius, if the parties didn't agree at the beginning, okay, this is the location at which you can't practice within X miles of, there was that default. Going forward, the default has seemingly gone away. And so it makes it even more important that employers and physicians understand and make sure that the location at which the radius is going to be triggered off of is really prescribed in the agreement. And then the real big drum roll is that everything we've just talked about with regard to physicians, as of October 1 of this year, is also going to apply to APRNs and PAs. And so all of the questions we've gotten over the last batch of years, does this just apply to physicians? Does this law just apply to physicians? We've always said yes, but now APRNs and PAs are in fact looped in. The one difference being that carve out for the 35, for physician practices with 35 or fewer physicians doesn't exist in the APRN context. So they're going to need, APRNs and PAs are going to need to be paid that additional compensation that maybe could be avoided if you're a small physician group employer. A couple of just case law tidbits. As I mentioned a few minutes ago, not too many Connecticut, we don't have many cases on the current law, never mind, of course, we have no cases on the brand new law, but it won't surprise you that the vast majority of disputes in the non-compete realm here are resolved through negotiation by the parties. But a couple of interesting ones. One Connecticut Superior Court case limited what I would have thought would have been a grandfathered older non-compete that maybe could have been enforced for more than a year, limited it to, in fact, did it choose to limit it to 1 year, determined that was what was reasonable. And then secondly, and I think this is a very important thing to keep in mind, we've got another Connecticut Superior Court case that seemingly would have upheld an older non-compete with a 2-year duration. In other words, the court said that would have been reasonable at the time, but there was one big problem. The court decided that the activity, the physician's new job, didn't actually compete with the former employer at all. And the court there went to great lengths to describe how just because we've got this law that says 1 year, 15 miles, doesn't mean that's always going to be enforceable or always going to make sense. So we can't lose sight of the fact that any non-compete still has to be, necessary to protect a legitimate business interest. It still has to be reasonably limited in time and scope based on what the activities are. And I think sometimes that can get lost because we have these really neat, clean parameters on duration and geography in the law. I'll change gears for just a slide or two on other states. So sometimes I know many of you who've registered sit in Connecticut, work among organizations in Connecticut, but sometimes you have practitioners coming from another state, or lo and behold, you're expanding into neighboring states. And so we pulled just a couple of the nearby states that we run into most often. So what does Massachusetts say? Massachusetts has a statute that pertains to contracts that create or establish partnership employment or other professional relationships with, interestingly, physicians, nurses, social workers, and psychologists, those 4 license categories. And they prohibit any restriction in terms of geography or time after the termination of the relationship. So essentially, nurse, social worker, physician, and psychologist non-competes are prohibited in Massachusetts. And Rhode Island's law pertains to just physician, and it restricts it prohibits any geographic restriction after the relationship ends, but interestingly also expressly prohibits non-solicitation restrictions with regard to patient relationships, which is interesting in terms of the public policy side of this. Rhode Island also expressly treats sales differently. So I had been talking about, while the Connecticut statute doesn't expressly address sales, or it doesn't address non-competes in the context of a practice sale, Rhode Island does. And Rhode Island has said that there is not a prohibition on physician non-competes in the context of a sale, so long as they're of a duration of no more than 5 years. And I think, Sal, I think that gets us to New York, which is your world.
Yes, it does. So for purposes of authenticity, I'm going to be discussing New York law since I have a New York accent and it'll sound more, I guess, official. But let's get started on New York. So New York does not have a state statute or regulation that covers non-competes in employment, just generally across the board. No industries are regulated. Well, there are a couple like broadcast journalists, but physicians are certainly not treated differently under separate statutes. So what we're left with is a situation where courts apply a sort of formula in determining whether or not a particular agreement is legal. New York law always says that the cases always say that they disfavor non-compete agreements as an unreasonable restraint of trade, but then somehow they always manage to somehow get one to be found reasonable. Okay, so what is the law in New York as far as that goes? A non-compete is enforceable to the extent that it's no greater than required to protect an employer's legitimate protectable interests and basically the reason for that requirement is that we don't want to stifle competition just for the sake of stifling competition. We need to be protecting something, whether it's, confidential information or goodwill or that sort of thing. So it has to be, and this is something we tell clients all the time. We get that you want to prevent somebody from competing with you, but you're really not going to be able to necessarily just put a blanket prohibition out there. You're going to need to be able to identify or at least articulate a legitimate protectable interest. Second factor that courts look at is whether or not it imposes an undue hardship on the employee. The next factor is whether it causes injury to the public. Now, I would think that something like that would have tremendous weight, or you would think that too, right? But unfortunately, the cases don't seem to care too much about that. They give it a little bit of lip service, but they don't necessarily weigh that too heavily. Of course, that's only in the healthcare context. As far as lawyers are concerned, that's weighed very heavily. One has to wonder, because non-competes in New York are not enforceable with lawyers, but they are with physicians. So this is one of those situations where the cynic in me says, maybe it's all about who you know, right? In addition to all of that, it's the agreement needs to be reasonable in duration and geographic scope. Okay, it can't be, and that to me is really still part of the first point, which is that it's no greater than required to protect an employer's legitimate protectable interest. They're sort of kind of similar because it's all based on reasonableness. What types of protectable interests may be sufficient to support a non-compete? Like I mentioned, confidential information or trade secrets, right? Customer goodwill, all right, which in this context would be patient goodwill, as long as the employee in question did not initiate the customer relationship prior to commencing employment with the employer. That's a pretty big deal in New York, although arguments are sometimes made that based on the employee's affiliation or association with the employer, they've been able to enhance that relationship, that prior relationship, or at least take it to a whole new level. Another protectable interest is loss to a competitor of an employee whose services are special, unique, or extraordinary. Now, this is a very interesting sort of interest, the special, unique, or extraordinary sort of factor. It was generally applied, I think the first case it was ever applied to was an acrobat, okay? But it tended to apply to artists and performers and people who really couldn't be duplicated in terms of, going forward, that if an employer had one of these people, that they had an interest in keeping those people. Does it apply to professionals? And I'm going to say yes. The courts haven't come out and said it, but it's sort of understood nowadays that it does apply to learned professionals like physicians and architects and and lawyers. But courts tend to gloss over it and just assume that that is the legitimate interest that's being protected in those contexts. Okay, next slide. All right. Oh, I apologize. Let me go back to that prior slide. So it's very difficult for me when people ask me, how long is too long and what's a real broad geographical restriction? And, in some states like Connecticut, it's obviously pretty easy now. I mean, you've got these defined parameters. Before you even get into the whole reasonableness thing, you've got to make sure that these initial thresholds are okay. But it's not like that in New York, and it's tough to generalize. It's tough to generalize to say, oh, well, a 2-year non-compete is fine or a 3-year non-compete is fine, because there are absolutely other factors that play into it. I can tell you, just to give you a few examples, in a vacuum, of what courts have found to be reasonable. So for example, a 3-year duration and a 30-mile geographic radius around each of the practices offices fell within reasonableness, according to the New York State Court of Appeals, which is New York's highest court. And these happen to be in upstate communities where one would think there were fewer doctors, and perhaps the public, there should have been more of a public policy of encouraging physicians, other physicians to be in the area, but not so. Another case held that 30-mile radius with a 5-year covenant not to compete was reasonable, and then again another one, 35 miles with a 3-year duration was found to be reasonable. I think, though, in my view, and this is my opinion based on what I've seen, I think it's going to be somewhat difficult to justify something more than 2 to 3 years, at least under the current environment. These cases are a few years old, and for reasons we're going to discuss in a minute, the trend is really, I think, there's starting to be a real pullback on these types of agreements. Okay, Steph, I'm sorry, you can go on. So what do other states do? Well, we already talked about Connecticut, Massachusetts, and Rhode Island. They banned physician non-competes outright. As of the last time we checked, which was probably last week, Colorado, Delaware, New Hampshire, New Mexico, and South Dakota also banned physician non-compete agreements. Other states like California, Oklahoma, and North Dakota ban all non-competes, regardless of industry. Okay, so that's sort of the patchwork of states and how they're dealing with it. But now the feds want to get into the act. So next slide, here we go. Okay, on January 5th, 2023, the FTC came out with a pronouncement along the lines of, non-competes constitute unfair competitive activity. And that's because they block workers from freely switching jobs, depriving them of higher wages and better working conditions, and depriving businesses of a talent pool that they need to build and expand. Okay, first let me say, this is a proposed regulation, all right? It's not in effect yet, and may actually never be in effect, or if it does come into effect, its scope might be somewhat reduced. All right, so next slide. Okay, who does this affect? Well, it affects all industries, right? But in terms of healthcare, it's going to apply to clinicians, hospitals, life sciences, manufacturers, and research. Okay, so it's not limited to any specific occupation or any specific profession. Okay, all right. So it bans non-compete clauses. So what are non-compete clauses as far as this regulation is concerned? Well, the first type of non-compete is the typical non-compete that we're all familiar with, that straight away basically says that that the employee or the worker, I'm going to say worker, and you'll see why in a few minutes, the worker will restrict from competing with the employer following, post termination. Okay, that's your typical thing. But then we have this other area, which is a gray area. It's clause 2 that you see on your screen. A non-compete clause also includes a contractual term that kind of functions as a non-compete clause. Okay, sort of like a non-compete clause in disguise, right? It doesn't come out and say you can't compete, but its effect is anti-competitive. And the reason those are covered is because they also ostensibly prohibit people from, getting ahead in their occupation. So, for example, a non-disclosure agreement between an employer and a worker, okay, a really broadly written one, could be considered a de facto non-compete clause. All right, again, it's a gray area, which is what makes lawyers nervous, because clients come to us to try to clarify this. And it's usually like this, it's a mishmash. We have to use our experience to sort of figure out what they're trying to say. a contractual term that requires the worker to pay an employer or a third party entity for training costs if the worker's employment terminates within a specified time period where the payment is not reasonably related to the costs the employer incurred for training the worker. By the way, I threw that in there because that is something that would constitute a de facto non-compete clause. But please, just because the federal regulation seems to indicate that this sort of arrangement is legal, it's not necessarily legal in every state where you can charge a departing employee for training for the costs of training. So just that's beyond the scope of this, but I just wanted to make that clear. Next slide. Okay, so what is a worker? I said employee at first, and I corrected myself with worker. Well, a worker, you can't have a non-compete with a worker. A worker means a natural person, okay? Includes an employee, an independent contractor, a volunteer, a sole proprietor, an intern. Doesn't include a franchisee in the context of a franchisee-franchisor relationship, but anybody who performs services as an employee or a consultant or a contractor for a franchise, for a franchisee would also be covered. So this is really, really broad. All right, this is not about employees, employee non-competes. This is really basically a ban of non-competes in all industries, regardless of whether the person is employed by the employer or the company. Okay, so the FTC regulation goes into other unfair methods of competition. So what are we talking about? So unfair method of competition not only includes entering into a non-compete agreement, but it includes attempting to enter into it, even having one, okay, from God knows where, if in fact, if it's in connection with an acquisition, for example, of a medical practice, or representing to a worker that they're subject to a non-compete agreement where the employer kind of knows that it's not enforceable. Okay, with respect to assuming this regulation becomes effective, and I'll give you an indication in a bit of when that might be. The proposed regulation does require employers that enter into non-compete agreements prior to the compliance date, whatever that'll be, to rescind the non-compete clause. And in fact, your employers are being required by this proposed regulation to notify employees in writing that that's happening. So here it is. The employer must provide the notice to the worker within 45 days of rescinding the clause. Okay, and that would be to current employees and even former employees who left you and are still covered by the non-compete. This is a very unusual in the law. This is a very unusual thing where you get a law or a regulation and it applies retroactively, not going forward. Very, very unusual. But these agencies, they tend to do these things. They actually tend to do a lot worse because they're not necessarily, this is my view, they're not necessarily authorized to be doing these sorts of things. Next slide. So there's exceptions to the non-compete ban. It doesn't apply to a person who is selling a business or otherwise disposing of assets. So that's sort of consistent with what you see in Connecticut, New York, and really most states that permit non-competes in the context of a sale or acquisition. Before we go on to the next slide, I want to just sort of give you a couple of thoughts on this. The FTC regulation. So the FTC proposed this regulation in January, and then set a date of 60 days for comments from the public. So that was supposed to end sometime in March. Then in March, they came back and said, no, we're extending it to April 19th. Okay. So they extended the comment period to that point. it looks like people are really, really, really taking a strong stance against this proposed FTC regulation. So much so that the FTC came back and said in March, after it said it would extend the comment period, hey, you don't like it, give us something else that you think might help, right? So so they're looking for alternatives, which indicates to me that they're certainly not going to go with this particular proposal. Either way, okay, and I'm saying regardless of how much of a change they end up making to the current law, it's a virtual certainty that we're going to see litigation on this. It's likely that the AHA and large healthcare systems are going to step in and litigate whether or not this statute can take place, this regulation can take place. Among other things, it might even be beyond the scope of the FTC's authority to do this. It's not clear whether the ban would apply to nonprofit hospitals. The regulation doesn't say, but the FTC operates under the Federal Trade Commission Act, which only applies which basically states that it doesn't apply to an entity that is not organized to carry on business for its own profit or that of its members. So that's an interesting point. But wait, there's more. Okay, another federal agency has decided to step into the mix. The National Labor Relations Board, which, depending on who is president, either will only focus on union activities, labor union activities, and employees who are part of labor unions, or will focus on everyone. And this currently, the NLRB's attention is focused on the employment on the employment relationship, whether it's for non-union or union employees. So on May 30th, an NLRB official came out and said that non-competes are usually illegal. Okay, how's that for a standard? Okay, try to interpret that when usually that's the case. The NLRB General Counsel, who's been very, very, very active in dealing with these issues, she sent out a memo to agency lawyers stating essentially that non-compete agreements discourage workers from exercising their rights under labor law, to advocate for better working conditions. Okay, they could prevent employees from speaking out to demand better pay. This is kind of the same sort of idea that the FTC threw out there. So now the NLRB is jumping on that bandwagon, and I should say this, that this is extremely, extremely, extremely unusual, because neither the NLRB or especially the FTC has ever addressed the issue of non-competes before. Again, it's always been a state-specific consideration or issue. All right, so we have a question. Do dentists fall under the definition of physician? And again, it depends on what we're talking about here. So I assume we're talking about the Connecticut statute. So Steph, do you want to go ahead?
So currently in Connecticut, they are separate. So again, do I think if a employer of a dentist were trying to figure out what would be viewed as reasonable by a court in terms of what they could enforce, I do think there would be a lot of talk in that proceeding about the 1 year, 15 mile, but they're not technically part of it.
Okay. Do we have any other questions? Well, I'll give it another minute, but Steph, you kept saying that last week was unexpected, right? And we didn't anticipate it. I think you're being modest, because I know you probably did anticipate it.
Well, we've watched it every year, right? So every year there's some version of a proposal to prohibit physician non-competes entirely. And when I say every year for the last 6 years, it dies. And this year it was, trickling along and trickling along and trickling along. And like most big things happened, on the last day or two or few hours of the session, which is in fact what happened here. But leading up to that, I was sort of like, what are the chances? What are the chances it's this year? And lo and behold, it was this year.
That was wild. And I think I'm going to say it again. I think you predicted it, which I think is why we scheduled this on June 13th and not June 1st. Oh, wow. There's a lot of questions here. Okay. Are psychologists included?
So in Connecticut, psychologists would be separate. So again, similar to other clinicians that are not physicians and now are not APRNs and physician assistants, they are a separate license category, which the statute does not pick up. But I do think that as a practical matter, the 1 year 15-mile is probably going to be what all the fight is about in any negotiation involving a psychologist.
Okay, Stefan, I'm going to direct these to you because these are all like sort of Connecticut stuff that and you're pretty up to date on the new law that's coming in. Do these amendments apply to independent contractor registered nurses in home infusion?
So if the nurses were APRNs, advanced practice registered nurses, then I would say yes, because I think that even though in this question or in this example, the nurse is an independent contractor, I think we've probably got the requisite professional relationship being established to trigger the statute. RNs that are not also APRNs would not be covered by the statute.
Perfect. Okay. So we have one more question that literally just came up. Do the January 1st changes apply to NPs in Connecticut?
Yep. So the 7-1, I think the 7-1 changes, those are the changes that were passed last week. That new law is effective July 1, but as I mentioned, really October 1 is the trigger date for the restrictions. We're talking about contracts that are entered, amended, extended, or renewed after October 1. Those do cover, some people would use the term NPs, some would say APRNs, but nurse practitioners, advanced practice registered nurses, I would are the same for Connecticut purposes. And so employers who employ NPs or APRNs, depending on what acronym you prefer, do need to be mindful going forward of the restrictions on what can be imposed on them.
Okay. If we don't have any more questions, I think we're going to sign off. Please feel free to reach out to either of us on any questions that you have regarding these or any other developments. And we'd be more than happy to answer your questions and point you in the right direction. Okay. All right, then. Thank you.
Thanks, everyone. Have a good afternoon.
Bye-bye.